so pleased to be joined on the stream by the inventor or founder of Cancard, Carly Barton. Carly, yeah, thanks for joining us on the stream. Like I was saying just before we went live, thank you for doing it. I guess like it seems like it's going to change so many people's lives for the better, and you know, stop patients being persecuted. How long has it been? Where did it all start for you?
So it's been quite a long road, I guess. I guess it really started at the point where, you know, my NHS prescription was blocked, and then I, you know, ended up strolling into the police station and telling them I was going to grow my own medicine, and sort of proposing that patients should be, you know, allowed or given licenses to grow their own medicine to support their health if they were unable to afford to pay for these ridiculous prices for private script. And we took that to the CPS, to some really high sort of police senior officers, and we managed to get them to agree to do a full legal review on home cultivation and how that's policed and how that could be, you know, how that needs to change, and that's going to happen in February.
Wow.
In the meantime, there was, you know, I was getting inundated with patients who, you know, were really in the shit for taking this medicine. You know, they would otherwise be able to walk into a private clinic and obtain a prescription, but they were being, you know, there's still arrests, there's still stop and searches, there's still things happening to these patients simply for managing their symptoms.
Yeah.
And so there was a clear sort of like need to put something in place before we have the legal review, so that possession cases weren't unlikely to, you know, to really hold much water as far as the law is concerned for medicinal use. And so I started then bugging my police contacts endlessly with ideas at like my 4 a.m. ideas of how we keep patients safe and how we help the police, you know, not go home to their families and think, you know what, I've done a really shit thing today. Because, you know, that's the kind of feedback that I'm getting from the police. We sort of saw this divide in that the patients are, you know, in fear of the police, and the police are frustrated and pissed off that they're putting in this situation where they're having to police something that makes them feel like shit at the end of the day.
Yeah.
And so there was frustration on both sides. And yeah, so there was a sort of clear, you know, there's sort of a clear need for something to change, or for there to be some kind of way of encouraging police officers to use their given discretion, or what they would say is something to hang their hat on. And every police officer in the UK has the discretion, but, you know, they will say, you know, every person I stop with weed says they had a bad leg or a bad back. You know, we can't, you know, we're not doctors. We don't have anything to say that person isn't, you know, involved in other stuff. And so we, along with the police, we came up with the idea of this medical ID card, in which we would vet these patients and that they would otherwise be eligible for a private script if they could afford it. And that would deem them suitable for a card that would keep them safe from prosecution, or, you know, or even, you know, going any further with a stop and search, being searched in the first place.
Yeah.
To try and help build the communication between the police and the patient, and stop the arrests, stop the emotional stuff that comes with those interactions. Because, you know, for patients, you know, most patients are, you know, normal sort of law-abiding citizens who, through no fault of their own, have been left in a situation whereby they need this medication to live their lives. And the thing that got me was the emotional turmoil that it brings when there's an interaction with the police, whether they come to the door, you know, and you've got kids there, or even just being stopped in the street. It's something that it's really hard for patients to get their head around. And I don't know why a vulnerable person should be in the situation where they're in fear of the very people who we apparently have, you know, employed to protect them. So it made sense. It was a sort of common sense project, really.
Yeah, nice. And like, just to be clear, because like I've been on the website and it says it all there, but who is this card for then? Like, what kind of ailments will be covered with it?
So our argument is based on the fact that we should be given immunity for self-sourcing cannabis for people who could walk into a private clinic and get this prescription. So I'm liaising with the clinics and the doctors who are writing these prescriptions so that I'm aware of what conditions are being prescribed for. Realistically, we could open this up because cannabis is an unlicensed medicine, so it could be prescribed for anything. Like, I've just stubbed my toe, that's fine. Have a cannabis prescription. It's like, it's going to, we're going to open it up to that extent. There is no, with unlicensed medicine, there is no list of conditions that cannabis is allowed to be prescribed for. It could be prescribed for anything. However, our legals are based on the fact that it's a sort of inequality. So if Vera down the road's got MS and she can afford a private prescription, why can't Susan, who's got MS, self-source without, and have immunity as well? So basically, any condition that is being prescribed for privately that has has patients receiving a script for privately, even if it's just one, that goes on the list. So at the moment, there's a list that covers things like, there's a psychiatric thing for people with anxiety, depression, insomnia, PTSD. There's, a neurological section for people with MS, with Parkinson's, with cerebral palsy. The list is quite significant, and that list is being added to every week. So we're going to see the number of those conditions increase as we see the private clinics step up to provide private patients with scripts for those conditions.
That sounds really promising, and I know that for a lot of people in the UK, the private clinics, it's the roadblock is the cost of access. So is the hope here that people that have the ailment that's on the list, that's on your website, can actually go to an NHS GP, get that written note and take it to you, and then be able to get this card?
Yeah. So essentially, with the private clinics, if you can go in with your summary of care and explain that you have a diagnosis, they will provide you with some kind of cannabis. It doesn't matter what ratio, they will decide what ratio is suitable for you. The only other thing that would make you eligible for that private prescription is that you've tried at least 2 types of licensed medication, or you have discussed them and sort of decided against them for whatever reason. So one thing I didn't want to do is follow that. Some of the clinics insist that you've tried 2 types of licensed medication. One of the things that I have changed with that is that I think that I don't want people going on to opiates or antipsychotics or anything just so that they can do a stint on them and say it didn't work and now I want a Cancard. So as long as you have one of these conditions and you can prove that with a summary of care, which every GP in the land, it's law that you can access your summary of care without any explanation. It's a phone call to the surgery, the receptionist prints it off, GP signs it, that then comes on a scan to us through the application process, and you just tick a box to say, look, I'm aware that there's licensed medication. I've either tried it or I've explored it and decided that for whatever reason, side effect concerns or dependency concerns, that's not for me. And I think that's fair enough, because I wouldn't want anybody taking more harmful drugs just so that they could get a Cancard to stop them from being arrested for taking the thing that does help.
Crazy, right? Compare the risk profiles there and having to try that before something that's super low risk. That sounds good that there is a way to avoid that. It sounds like there's a lot riding on the GPs here to be confident in writing that prescription and being able to say, hey, you haven't tried these 2 other prescription drugs, but I'm comfortable we bypass that. I'm sure that perceptions are changing within the medical world, of course, but do you have your finger on the pulse of these GPs? Do you think that they're going to be forthcoming in having those conversations?
So in order to get the Cancard, there's 2 types of ways you can verify. So either an email goes, and like a DocuSign goes to your GP, and your GP says, I confirm that my patient has one of these listed conditions. We don't even need to know which one. I confirm that they've tried or discussed 2 types of medication, signed it, comes to us, we verify that, and the card is dispatched. The issue with that is, with some people, is that the way that the NHS still operates is that they restrict access to some services if you say that you're a cannabis consumer. So this is especially true with mental health services. So for example, a patient can't access mental health services, things like therapy, CBT, until you've been 6 months off all illegal drugs, and that includes cannabis. So what I didn't want to do is place the patient in a situation whereby they went to their doctor, had this discussion, it went on their records, and then for whatever reason down the line they need some therapy, and they aren't allowed to go that, they don't get the funding for the NHS therapy. So there is another way in which you self-certify. So you just get a printout from your doctor of your summary of care that it is a legal requirement for them to provide you with that without explanation, and you send that to us, and we would verify it, that you have a condition on that list. So that means that patients who are maybe less comfortable or have had a tricky time discussing this with doctors have got that route to go down. But it also means that if you don't want cannabis on your record, you don't have to have it on your record. In terms of getting GPs on side, I think it's a tricky one. I think there are a lot of GPs out there who have moved to a space where they would like to know more about it. So we've teamed up with the Primary Care Cannabis Network. We're going to use their information and direct GPs for information to them so that they can become part of the GP community, talk to other GPs about their experience and educate themselves better. Patients can download that document from our website and send it to their GP as they feel appropriate. I think that the GPs are an army, really, that we aren't utilising them just yet. I think that they feel quite left out at the moment, and it would be great to do some kind of campaign once we've set up to try and get these GPs into a space where they feel more comfortable discussing this with their patients, because really, like, the GPs are like the center of the patient's care. They know what medication they're on, they should know about interactions, they should know about the whole picture, diet, everything. GPs should know about everything so that they can properly make it, give the right advice. And at the moment, GPs are left out of the discussion with cannabis, and that's for lots of reasons. That could be because a patient has had a shit experience, and that could be because they are in fear of the GP reporting to social services or the police or the DVLA, or from putting it on their notes and them having restricted access to NHS mental health services. So there's some blocks there that we need to get over, and I think that the first port of call is to go to the GPs and see if we can do some real work to try and help expand their knowledge and their confidence more so in having these discussions.
Yeah, well, it sounds like the GPs and the police have been kind of put in an impossible situation because of the legislation at the moment, right? Like, cannabis is available on the NHS. That's what people think, but it's really being left to the police and well, I've heard stories of GPs sending people to Holland and Barrett to go and get some CBD oil, because that's the only access they can give their patients. It seems like this is seems the natural thing, and hopefully will make everyone's lives easier, not just the patients and but the police and the GPs as well. Yeah,
for sure, absolutely. And I think we're gonna do some campaigns around GP awareness and do some courses and do some content to support that down the line. And I think that I think we're just going to have to come at it from lots of angles. And I think the way I see it at the minute is all the stakeholders have been sort of isolated in these like little segments. So we've got the patients over here that have got their own concerns. We've got the police over here who've got their own stuff, the GPs, the MPs, and everyone's in their little tiny like bubble, just like not communicating with everyone else. And so I think something that I saw, that there was a gap to bring people into one space so that we can all understand this better, and we can all understand how to support each other in a more open and honest way. So that's what I'm hoping Cancard becomes.
That's what I was finding interesting as well, because talking about all those little pockets, how does it work with the police? Because the police here seem to be working within their own constabulary constituency in their areas. How do you go about speaking to all of those different police chief officers and make sure that they're all on the same page? Because as we see here in Wales, like in North Wales, you've got Arvon who's changing things up and allowing kind of like cannabis users, not to get away with it, but there's no real, it's not a huge threat to people. But then you go across the border to Liverpool, and it's incredibly hard.
Yeah. So one of the things I think that we have one of the things I did wrong with Carly's Amnesty was to try and broach this at a local level, and that meant that we had support in some areas for patients to grow their own, for example, and really, a real backlash from some others. And so I learned quite quickly that that's just not the way to do it. To go local is just creating a postcode lottery within a postcode lottery, and it's just going to make the patient's experience even more, even more poles apart geographically. And so what we did with Cancard instead was we went to the top. So the only way that we can make change operationally in the police without a change in law is by national guidance. And national guidance comes from the National Police Chiefs Council usually. So, for example, the recent operational change around stop and search, around them needing another reason to stop and search you other than the smell of cannabis, that operational change comes from the National Police Chiefs Council and then gets operationally sort of distributed locally, and they have to follow that guidance. It's like your high school teacher changing the rules. It's just one of those things that you have to go with. And so, changing this locally was never really going to work because we have stigma in some areas and not in others. And we have more educated PCCs than we have police chiefs. So I went to the National Police Chiefs Council because ideally I wanted this to go nationwide straight away and issued with national guidance. I thought that was well cheeky and that I wasn't going to be able to do it. but it turns out that it is, and it is being. So realistically, all of the forces, despite the individual stigma and the lack of education and willingness to move, are going to be told to shift in quite a
how do you kind of approach them? Do you go with the doctors and do you go with papers in hand? Like how was that process?
So it really, with the police, it's like climbing a ladder. It's like, so I've had these like sort of low level contacts. I've sort of wormed my way up and then had a cup of tea with someone up here and then, just basically a massive chancer. I just sort of chatted my way up the ladder on Zoom calls. And then came the sort of big moment when I had to speak to the head of the National Police Chiefs Council, which was absolutely petrifying. And he has an excellent poker face. So I was like, I don't know if he likes what I'm saying or not. But it turns out that, after that call, I think there was a lot of the really senior organisations involved, and I really had no clue if I'd done the spiel correctly. And so they were like, when you started this, we were kind of like, absolutely not on your Nelly. There's no way. But by the end, they were like, have this resource, you can have this staff officer, we're going to do this, that, and the other. This is brilliant. So it was just about, I think it's just about removing all the bullshit and having a human conversation. And I think it helped that I'm a patient. I'm not, I'm not I'm not coming at it with screaming and shouting, fuck the police. I'm not like that. I'm just a woman who has pain. And so I just had a chat with them, really.
Here's an interesting idea. Like, do you think that COVID has ultimately helped patients like you get access? Do you think it's made it easier for you to get in touch with these people? Because you mentioned about being on Zoom calls. Like, as a patient as well, I can imagine getting out of the house is hard sometimes, depending on like good days and bad days. Do you feel like COVID and everyone being home has given you easier access to these people, like because you can talk to them, or is it still?
I think sometimes, and I'm pretty sure I've done a few calls where they have only been dressed from the waist up with some extremely important people. But I do. I think that probably, I think while they're at home, they think, oh, Carly's ringing, I'll answer it, because they're not like, I don't know, in the nick or wherever they are. So maybe I think it's sped up the process a little bit in terms of getting the comms sorted and getting the police training packages done and all So yeah, so I think maybe it has.
Sounds like you've done a great job to see that progression from them not being interested to being fully on board. And this sounds so promising that it's going to help a lot of people in the UK. You alluded to something earlier about like a legal review taking place in February. So it sounds like there's maybe some other things in motion now. I'd be interested to hear like what the scope of that is and what you're hoping the outcome of it would be.
Yeah, so we basically presented to the DPP, who's the Director of Public Prosecutions, and the CPS. We basically presented a bit more of a formal legal argument than it wasn't me having a cup of tea with the head of police. It was, the barrister got involved, and we made it quite formal, and we made sort of arguments based on abuse of process in these cases for patients who, and also sort of challenging the Quayle, what's the word? So the Quayle defence means that we can no longer pursue an argument of human rights for cultivating cannabis for medical necessity, which is a real issue. And we believe that now things have changed and there's more science, and people are legitimately accessing cannabis with medical necessity, legitimately, legally, and through a doctor in this country. So we believe that the Quayle precedent should be re-challenged. We also think that there is a lot of evidence to suggest that there is harm caused to the community and to families in pursuing people for small cultivation, small grows. And so we presented that and offered them the chance to support Carly's amnesty as an idea. Now, what that would mean is that, people would be allowed to grow up to 9 plants for personal use with sensible sort of guidelines on how that's done. So as long as it's safe and kept away from kids, like sort of common sense stuff. Yeah. And they've taken that quite seriously, and now that is what they're doing now is gathering evidence to see, because they didn't have any stats on how many. They know about cannabis arrests, so they know, okay, so there's this many cannabis arrests in 2019. They know that. Well, they don't know how many of those people are claiming medicinal use. They don't know how many cultivation busts were people legitimately consuming medicinally. And so they're lacking evidence to support any kind of change. So we're going to help them, provide them with, patient testimonies and things like that to back up the fact that we think that there is there's an abusive process in policing that at the moment. Wow. So they're going to start to conduct that review in February. So I'm sort of well armed with, horrific but incredibly poignant stories from patients who've suffered as a result of prohibition, and parents whose kids now are terrified of the police because of the smash through the door and things like that. And I think that's something that they've never really looked at, not at that level, not at the CPS and DPP level. And so this is something that could make a change for the better. And so what I'm hoping is Cancard will transition from a medical ID to stop arrest for possession, and will then become licenses for people to cultivate small grows and support their own medication in that way. And then we can, then that would be a better use of our time in harm reduction for patients, I think, to sort of steer them away from organised crime. But I'd also really like to look at access in, cooperative grows. We're going to have an app. So in the future, I'd really like Cancard patients who didn't want to grow, who were maybe too ill to grow, or it was too painful for them, or they didn't have the space to be able to order their medicine through the app. I think that would solve everything, and that would take away organised crime. We'd be able to support our amazing growers and cultivators in this country, and hopefully we'd be able to do that with full police backing. So that's something that's on the cards. Yeah, it's going to take a bit more charming, I think, before we get that permission, but I'm on it.
A few more cups of tea. If you want us to send you some hobnobs to take along, that might.
Definitely. I think it's going to need a lot of cake, that one, but they know that that's where I'm going, and they're kind of like, mm-hmm.
Nice.
Well, that's the way they started with Cancard, so I'm pretty sure we can win them round.
Nice. Just last question. So when can the first people expect their Cancards? When are they going to?
So the website's open to register your interest now, and then you're going to be able to do things like upload your photo and do your ID thing on the 30th of November. And then I'm anticipating that we're going to be inundated, but we're going to hopefully get them out within a couple of weeks. We're trying to keep the ID sort of process as simple as possible so we can reduce waiting times and things like that. But so hopefully we should see them coming out before Christmas.
Wow. Well, good luck with that, and good luck with the challenge in February. Yeah, can't wait to see what happens.
Yeah, absolutely. We'll keep you posted.
Yeah.
Yep. Well done, Carly. Keep up the good work.
Thanks, guys. Thanks so much.
Thank you.